There it goes.
All right.
There's no picture, though.
Really?
There we go. Yeah, there we go.
All right. I'll put the camera on you. Give me a second.
Current frame rate's too high. Please set the frame rate to 30 frames per second or less. I don't know where that is. Yeah, don't know what that means.
Is it working?
Yeah.
All right. I'm switching to
Hey,
you.
everyone.
Talk for a minute. I'll be right back.
Check. Well, okay, so the audio's good then. All right. Hey, everyone, thanks for joining us. We were starting off late today because, well, if you saw the notification, Spencer was late again. I can't let him take all the blame for that or all the credit. Depends on how you feel about it. But, yeah, so we have technical issues sometimes. That's the way it works. It's a free program. Get over it. Anyway, so yeah, we're starting an hour late. It's actually more like an hour and 15 minutes late. I just realized for those of you in the UK, it's still, was it 11? No, 10 something? I think FSK in the chat room, you're in the UK. What time is it there now? It's because it was, we jumped forward an hour for daylight savings time. And I think it's still 10 something for you, even though it's an hour later for us right now. Yeah, okay, that's what I thought. Good. So, yeah. Let's look in here. So if you saw the title and the announcement of the show today, we're going to be talking about something that's a little bit more serious. Not for the entire program, but we're going to be talking about the coronavirus, COVID-19, and hair transplant surgery. A lot of people travel for their hair transplants to other states or other provinces or even other countries, as many of you know. And so we're going to be talking about how that's affecting your choices, how it's affecting patients, and how it's affecting the clinics. And I can tell you, the different discussion groups I'm a part of with different doctors, it's interesting to see their take on it. Just like with anything, some people are worried and some people aren't. The thing about this is, the doctors themselves, they understand this better than the average person. So it's nice to see that the hysteria that is prevalent, in my opinion, online in the media, it's not filtering over into these clinics, at least most clinics. And so I think that if you're considering something like this, even in a time of coronavirus, I think that as long as there aren't any travel bans in place that actually physically prevent you from getting to your destination, I don't think it's going to be a big deal. As long as you're following proper protocols for hand washing and not touching your face, not sneezing on someone, common sense stuff, then everything's going to be okay. I don't know how Spencer feels about it. We've not talked about it before the show. But I think it's an interesting subject. And, of course, I'd like to know what some of you think. You can talk about it in the chat room. And, of course, you're welcome to call in once we get the lines open and Spencer comes back. So see what's going on in the chat room. We got, see. Yeah, some interesting comments. Yeah, sorry, B Wood. Yeah, you're about on time. About an hour late, but we did plan on starting later today. Let's see. As long as we don't give it to other people. Yeah, exactly. FSK says as long as we don't give it to the elderly, then it's all good. And I agree with that. In fact, I even came down with a head cold starting 2 days ago, and the first thing I thought was, do I have Wu-Tang Clan? And then I started looking up the symptoms, and of course I don't. I just got a head cold, which happens around every time this year.
What's interesting
during
is
daylight savings time.
You are the elderly. You're an elderly gentleman.
I'm a sprightly young lad compared to you.
How are you guys?
Don't you forget it.
Oh, it's forgotten. Let's start the show.
Start
Hey,
it
the
up.
Red Rocker Sammy here.
And Michael Anthony.
You're listening to the baldest on the planet, Spencer Corbin's The Bald Truth. Woo!
That was a simple opening. Hey, guys. I am
I liked
sorry that I am late. I think I'm coming down with something, Joe. Got to tell you. A little under the weather.
Well, to answer FSK, he says, "What's a head cold?" That's a North American way of saying an upper respiratory issue, like, stuffy sinuses, sneezing, like that.
Yeah, usually some sort of a viral infection that causes a common cold that could end up turning into pneumonia for a man your age. Come on, just go with it, man.
You're just trying to get me to accept it, aren't you?
Yeah, guys, 888-659-3727 is the toll-free number. Thank you so much for joining us. I think Joe did a very good job trying to open the program with no production. We were just lucky that we were able to stream. This thing under my eye, I should cover it up. And it's actually getting better. But yeah, coronavirus. I was on the phone most of the day today with, and I say the mainstream media because new media, social media, online media is really the media, I guess, now. But when the mainstream news organizations, the ones that you guys all know, like the New York Times and the Washington Post, or, some of the UK media outlets, that were originally not online, but now are both in print and online, when they contact me, or when CNN contacts me, I consider that the mainstream. And I guess that's going to change. But long story short, there is a lot of talk and concern about elective surgery during this health crisis, undergoing elective surgery, whether it's prudent to undergo elective surgery during this health crisis. Now, what I explained to a couple of reporters is that, listen, if somebody wants their hair back, nothing is going to stop them. If they could find a way to make it happen, they are going to get the procedure. As long as the physician's doors are open, they're going in. Now, will they travel across the world? In some cases they would, but that is not going to be something that's going to be an available option now for most people. Obviously, there are travel bans here coming into the U.S. Don't quite understand why there's no travel ban as far as the U.K. is concerned. Because to me, can't someone just fly from, say, Italy to the U.K. and then fly to the U.S.?
You can, but I think because of the way that Homeland Security is set up, when you're flying from Europe into Heathrow, and then you're going on to the States, they actually look at your travel history right before you're getting on the plane.
Yeah, but can't someone travel like a week prior into the UK? And yeah,
probably. But there are I think there's someone in the chat room that can answer this better for us, but I'm not going to single them out. But they do look at the travel history, like when you're coming in before you get on the plane. They know your travel history before they don't even have to ask you anymore. So if they say that you were in Italy last week and now you're coming to the States from the UK, no, you're not getting on the plane. I think they stop that before the plane even lifts off.
Okay,
I could be wrong.
I have no idea. All I know is that it was interesting because there were actually the physicians, and it's just I guess because the way the travel ban was announced, I thought it was clear, but it seemed like there's a lot of Americans, including some physicians who we are in contact with, who are also in these online groups, private groups, who believe that they wouldn't be able to get back into the country, like they're going to be fucking locked out. And I'm thinking to myself, this one guy writes like he's trying to get back from a certain place and he's worried about that. I'm thinking, these are doctors, man. All you have to do, simple, if you don't have the information, you contact Homeland Security, you contact the airlines.
You mean actually pick up the phone and try to ask someone?
I would have actually gone online and checked their websites because it was all detailed almost immediately. These guys went to fucking medical school.
That doesn't necessarily mean they understand.
I'm learning that. I'm learning that more and more. But I think it's an interesting question. Now, this is something that's really not talked about for whatever reason. I guess, the physicians aren't being contacted, or the scientific bodies, which are more like trade organizations, aren't being contacted by the mainstream media about this. They obviously come through the American Hair Loss Association and the IHRS. And I actually got one media inquiry through the Bald Truth. That was about an hour ago.
Okay.
So what is my take on things? My take on things is this. I think that the spread of the virus and the spread of...
You want to switch the camera onto you as well?
Why?
I don't know. I was just asking. Because the camera's not on you right now.
It's on both of us.
Oh, it is? Oh, okay, never mind. Carry on. I knew that.
What the fuck is going on?
Nothing. Nothing's going on. Let's see. Continue.
Okay. I would say that, the facts of the virus, what we know about the virus, does not necessarily justify the panic that we are seeing in this world, in the streets. I definitely think it justifies what the local governments are doing. I think it justifies what our government on a national level is doing. But as far as the personal panic and the fact that, I went to the supermarket yesterday like an idiot just because I needed salt and I didn't order it. It was fucking mayhem. And we're not talking about some kind of, and this is going to sound obnoxious, we're talking about a lot of well-heeled people here in, Southern California, in a very well-heeled area, acting like animals. If I were to send you guys images of what I saw, fucking open packages of Cheetos on the ground, on the fucking floor. No toilet paper anywhere. People fighting over maple syrup. I say people fighting over maple syrup, Joe.
I didn't know that was my cue. I'm sorry. I'm just finishing up the posting of the link everywhere. Maple syrup.
Can you believe that?
I can't even believe that. That's absolutely crazy.
It's insane.
It is insane. I actually thought the toilet paper thing, which seems ridiculous to me to begin with, but I didn't think that it had actually ventured up here into Canada, and I went shopping yesterday, and sure enough, the toilet paper shelves were empty except for 2 packs left. And yes, I bought both of them. It's a herd mentality. It's like, I might as well.
Well, I don't understand. It's like, why? Don't you guys think, what is going to stop people from getting their paper products? Are they not manufacturing paper products anymore? Are they not going to be shipped to the stores?
Well, I think trees are endangered now.
But
so the paper mills will be shutting down.
What the fuck is going on? We're not talking about, it's not a hurricane. It's unlikely that we're going to have to hunker down. And if we do, then, you get Amazon Fresh, which actually is having trouble right now because people are losing their fucking minds. But to get back,
Amazon is working fine.
but to get back, well, Amazon Fresh is having some problems with delivery, and they're out of a lot of stuff, and even Whole Foods delivery service is having problems.
Tyler D in the chat room says, I'd rather have coronavirus than live in California. That's great. That's funny.
But so anyway, we have been asked through the American Hair Loss Association to provide an interim clinical guidance for management of patient safety to a couple of mainstream outlets, including one government agency. Now, this is a pretty big deal. And I think that it's pretty telling that the government and these other outlets, they want to make sure that the economy keeps on, ticking along, and they don't want people to be overly fearful to go on with their everyday life, including some elective surgery, which I found interesting. My hope, and this is a real hope, is that the ISHRS or these other bodies do not try to send out some sort of nutty press release that will actually interfere and harm the industry, as well as put a lot of fear into the hearts of vulnerable patients. That's my concern. I wasn't going to make that announcement on our WhatsApp group that this is happening, but I wanted to get some feedback from some doctors as far as, what sort of clinical guidance as far as patient safety and the management of patient safety we should be providing through the IHRS. And obviously, we've already written something up. But I want the IHRS to know that this is not a competition, that we all need to work together to make this happen so that patients who are coming through your members' doors are coming into a safe environment, and that all of the staff in your clinics are practicing basic safety protocol, that everyone is protected, that if someone is not feeling well, that they are staying home. And that maybe, even if your technician has to stay home, you'll pay them so they can pay their rent.
Yep.
So they don't endanger your staff or your patients. Let me tell you this. If there's one of your staff members that is found to have coronavirus, you guys are shut down for a fucking month.
Yep.
And there's a lot of...
That's why I was saying on in one of the groups that if the clinics haven't had meetings about this yet, they should. Where we can feel pretty good knowing that because it's a medical environment, and if proper medical protocols are followed, then this shouldn't be an issue. But what happens when the staff leaves the clinic? Are they still being aware of their surroundings? Are they still being aware of the potential for contracting this virus while they're out in the wild? Because if they're not, then that's putting not just themselves at danger, it's putting their colleagues in danger, if at the very least of being able to make a living.
Well, but here's the good news for patients. One thing that really protects you, a lot of people are buying masks to walk around and thinking they're protecting themselves from the virus. The reality is it's the other way around. Those who are wearing masks are protecting those around them. Those who have the virus or any virus are protecting those around them from contracting that virus. So as long as everyone is suited up, you probably have less of a chance of contracting coronavirus in a accredited medical facility, a private accredited medical facility, than just taking a subway ride or a bus or going to a movie theater. And I think that's important for patients to understand.
And I want people to completely discount comments by people that are out there right now saying wearing a mask is useless. It doesn't prevent infection. I remember hearing that from the very beginning. People were saying, I don't know why people are doing this, because unless they got a specific mask like an N95, it's not going to do anything. That's complete horseshit. At the very least, if you have it on your hands, it prevents you from actually touching your face if it's covering your nose and your mouth. That's the bottom line baseline That didn't sound right. That's the baseline of what it can do. But if you already have gotten this, and you don't know if you've gotten it for many days after you've contracted it, it can help prevent you from spreading to others if you start, sneezing or coughing, things like that. So it's not, foolproof, but it does at least add some sort of layer of protection that you normally wouldn't have without it. So keep that in mind.
Yeah. So I mean, there are guys. We're getting countless emails to the IHS and the American Hair Loss Association from guys who are scheduled to have surgery, and our response is essentially we're sticking to CDC guidelines. If you are within your travel limits, if you are local, and there has been no evidence that there's any virus or anyone found to be infected with the virus in that particular clinic, and you can call the clinic to ensure this, they have to essentially tell you the truth, then you should have no issues. And like I said, the likelihood of contracting the virus during a procedure, especially if everyone, the entire staff, is suited up, it's pretty unlikely. And as a matter of fact, I think that you're probably less likely to get even a more common infection in this particular circumstance. And again, I'm not a physician, just because everyone's going to be so fucking hypervigilant that they're going to be totally suited up from, beginning to, as soon as you walk into the clinic, which, you don't really see receptionists wearing fucking masks when you walk into a clinic. That is going to change now. That shouldn't scare you. That should actually give you a little bit of confidence, a little bit more confidence that you're going to be okay. So if you've scheduled your surgery with an IHS member and you have taken off work and you've rearranged your life for this, just call up the clinic, make sure everything is fine, make sure they're taking all the right precautions, and I would say that, again, I'm not a physician, but I would say there's a pretty good chance you're going to be just fine. Now, that can change in 3 weeks. We can be coming on the air and saying, listen, we've gotten together with the CDC. The CDC is recommending that you guys don't have elective surgery. That's fine. That's going to be posted also on the CDC website.
Yeah.
So just chill. But I will tell you that they're on it. The mainstream media is on it. And I found it fascinating just how many phone calls and emails I received today about this, when no one in the industry is talking about it. They're concerned about losing patients. They're concerned about people canceling. But no one said, well, we've been contacted by the media asking about this health crisis and whether or not people should be having elective surgery. Maybe they have been contacted, but they don't want to talk about it.
That would be interesting. Like, why would they want to talk about it?
I don't know. I don't think they were contacted. That's the thing. That's how irrelevant these other organizations are, to tell you the truth.
Yeah.
It's a terrible thing to say, but it's the truth. Sorry, guys.
And, it's interesting you say that because, a lot of these organizations are irrelevant or even becoming more irrelevant, and you can see it with how some of them are conducting themselves, latching themselves onto, I don't want to get too far into it, but just latching themselves onto other organizations and what they're doing to try to feed off of what's going on, or try to what's the word I'm looking for?
Exploit.
Exploit, yeah. Pick up breadcrumbs. That's what I was looking for.
Well, I will tell you what this, and guys, we're going to take your calls now, and this is some inside baseball, but it's important that you know this. Things are going to change pretty significantly, and maybe this will actually be good for the field and good for consumers, because there's going to be a shift based on how some of the other organizations handle this crisis. And so far, it doesn't appear like they're handling it well. I've seen nothing out there on their websites. I've seen no mailings going out to physicians. I have seen no position statements. Nothing. And that's fucking amazing to me. Now, my hope is that they don't send out some sort of ridiculous press release that I'm sure, especially after hearing this, they're going to try to put together because they have this incredible fear of competition. We're covering it. And the reason that we're being contacted is because the mainstream recognizes us as a unbiased, legitimate resource. Guys, the phone number is 888-659-3727. I say legitimate resource. Joe.
Yes, I know. Sorry, I'm just
Jesus. Let's take a phone
mistake.
call.
Let's do it.
Take a phone call. And eventually I'm going to get a more engaging, at least engaging with me, person to sit across the desk here. I'm just kidding. I love Joe. Hey, man, you're on the air. Who's
Love you
this?
too, man.
Who's this and where are you calling from? Hey, man, what's up?
Hey, guys. I'm not sure if it was me or if I was on hold.
It's you.
Are you able to hear me?
You were on hold, but now you're live.
I'm sorry. I wasn't sure if I wasn't in the queue. I got the notice like, hey, Friday night call. I was like, oh, man. Normally I hear the show going on. So, anyways, hey, what's going on? My name's Colin. I'm from Baltimore. I was on the show before.
Hey, Colin.
Actually, it was...
Hey, Colin,
it was
I have a question. You just said something. When you were in queue, did you not hear the show through the phone?
No, I came in late. I came in right when we were talking. They were talking about.
No. I guess my question is, when you called in and you were in queue, were you able?
I heard the whole show. Yeah.
Okay, great.
Yeah,
okay.
It was great. Well, I was going to say at first, I was like, oh man, I'm off work early. Got so many hair transplant questions because I'm doing a great regimen, and then I was like, oh, coronavirus. I'm like, whoa. So I wanted to let you know what's going on where I'm at for the viewers and my opinion on it. So
yeah.
Thanks for everything. Thanks for coming in. So I live in Maryland. We are in, how would you say, I wouldn't say it's a state of emergency because we have some.
Well, the country is, so you are.
You are,
yeah. I must have missed that because I have to go into work. In Maryland, state employees are, if they can telework, they're advised to stay at home. All the small businesses, such like that, they're advised to stay home. And I can understand the fear for people who are single mothers, single fathers, in the sense that because they shut down schools for 2 weeks, so they're probably freaking. That's why they're buying all the toilet paper because kids can't stop shitting. But that's what it's like. I mean, you know how it is, and that's what's going on over here. They're trying to do their best by containing it because, I guess in their method they think that, oh, hey, it's like the flu. It's closed down for 2 weeks. We only have small situations. But apparently how we got the infection was, you can find it online. I can't recall, but it was the state they came from. But they were out of state. They don't live in Maryland. They had a part-time job over here. They came in, and then they spread it. And it's like, how do you find out
the first known case in the U.S. was in New Rochelle, New York, and they are completely quarantined and shut down. Right. I mean, the National Guard was the first place in the country the National Guard was called in, and I mean, listen, I understand. Listen, I understand that this is something that is it's coronavirus itself. It's an old virus, but this is a new strain of coronavirus, and I understand how scary it is because of the numbers that have been found and the number of deaths. Now, we don't know what that percentage is going to be once they find out exactly how many people have this virus. I'm assuming that there have been thousands, if not tens of thousands or hundreds of thousands of people walking around with this for months. They felt a little under the weather. Yes. They didn't know what the fuck it was. They got over it and they moved on. But unfortunately, they passed it on just like any other virus to other people.
Mm-hmm.
So
exactly.
That's just the way. That's the way that it is. Go ahead.
And I was going to say, unfortunately, the problem is social media is a blessing and it's a curse. And it's funny because in our previous shows, if there's new viewers coming in, that's why we always talk about don't get a hair transplant, because you have so many people saying, oh, yeah, yes. but they're terrible, and they come over here crying about their lives. They're doomed in their research. With that said, the social media, at least in the United States, I feel, is they're politicizing the event opposed to trying to calm people down. And with that said, not getting into the politics side, is people are obsessed with social media. If they don't post an image, they don't post a status, it didn't happen. Their life doesn't matter. So if they, and we're talking about the panic. Oh my God, this, oh yes, this is a serious event. I'm not denying that. But so many people, if you got a lot of followers, and it's like, oh, how do I stay relevant? Man, what do I do to make this seem so dramatic? Just like the news media outlets. And that's why this episode is so great, because I had a lot of hair transplant questions for you, but I rather cover this for you. It's like,
Yeah.
no, you're not using this episode to freak people out. You're being neutral. Yes, I understand, but people are blowing this up. So you have the, unfortunately, dumb person, the common folk that see these posts and they freak out. They're the ones running out in the stores, stealing all the toilet paper, stealing all the food.
Well, the thing is, social media, and it's used this is the way that it's used. I mean, it really greases and amplifies the dramatic headlines out there, and it squashes the more nuanced reality. And because it's not as, again, everyone wants to be involved. Everyone now has the ability to have a voice and get their story or get the story or get their experience out to the public. I have dozens of pictures that I was just sending to, my girl and, other people when I was at Ralph's here in Beverly Hills yesterday, just to show the empty shelves and the crazy people, like this crazy woman in this yellow raincoat, okay, with a hood on and a mask. Mm-hmm. And I'm thinking to myself, well, first of all, I think that it illustrates, what the online world has done to people and social media itself. It has turned crazy people even crazier. It's turned sane people, into paranoid, potentially, in some cases, delusional fucks. I've seen people packing their Mercedes, with water yesterday. I'm talking about gallons and gallons of water. Like, what's going to happen? How is coronavirus going to stop the tap in your apartments or in your homes?
Exactly. And what it's like is, if it's in your area, if it's in your way, unfortunately, everyone's freaking out. The preventive measures, I would think, is stop, just like as Joe used to talk about one of his shows on his channel about how to make your hair healthy, prepared for a transplant. Stop eating the bullshit food. Stop eating the foods loaded with sodium. Eat more fruits and vegetables. Eat more natural things to build up your immune system. So if you are sick, you get over it. If you're older, if you're prone to this, build it up.
I will tell you this: this one Ralph's has a chip aisle, potato chip aisle that is 7 feet deep. The entire thing was empty. And when he went over to look for oatmeal and other potentially nutritious foods, peanut butter, things like that, plenty of it. Mm-hmm. This is the world we live in, man.
And since I've really studied so much through, I haven't seen every episode. There's so many episodes of you guys, and I've studied a lot of Joe's stuff. And to take, with the episodes about the coronavirus and the fear of hair transplants, from what I've gone from this, you also correct me if I'm wrong, because you are the masters at it. But and you're not clinically proven doctors. The side effects from if you're sick, I feel if you get the coronavirus, it's an extreme case of the flu. But if you're getting a FUT or FUE and it heals up, you're just going to have, you possibly have really baggy, swollen eyes from the numbness they put in your head.
Well, no, I mean, if you're ill, that's a good. That's the picture.
No, don't get that. But I meant because you were discussing about if you have a trip plan, don't, still maybe possibly contemplate if it's worth it, but don't let this mass hysteria of online. I was just saying, like, the worst case scenario, you go over there, or you do in the States, the country, you get the surgery, you have the healing process. Because maybe some people might think that, they just had surgery, which you all emphasize, which I understand, because so many clinics say it's not surgery, it's a hair transplant. No, you're getting the back of your head sliced open, or you're getting your head ripped open and put in your side. That I don't think that the healing process of a hair transplant will affect you if you have the coronavirus, and that is where I think is people might be afraid to continue with what they're doing.
Well, I'm gonna interrupt you for a second. What I would say is that when your body is going through a process like that, when you're fighting off a virus, other aspects of healing and wound healing are going to be slowed down. That's just the way that it is.
Oh, that's true. Oh, yeah. I never thought about that. Yes.
So what you want to do is you want to make sure that you're as healthy as possible. Now, you cannot, you want to try to mitigate that possibility, but you can't be for sure that, it's possible that you are going through the incubation period, you have the surgery, and then 2 days later you fall ill. That's always a possibility. But that could happen with any illness, any virus, at any time. Especially during flu season, flu and cold season. So, that is just something you just have to be aware of your body. You have to make sure that you're feeling okay, when you go in for the surgery, and you want to mitigate that possibility, possible damage. But if you are ill, if you're feeling a little under the weather, cancel your surgery. Not just for yourself, but also for those around you, for the staff of the clinic, and for other potential patients who are going to have surgery the next day.
Yes, definitely. And I would also think, everyone sees how do you make a positive out of a negative. And what I study from the show, from Joe's teaching, is most of the time, most people need more than one hair transplant. So you can use that as, hey, I have more time to save up. I can schedule it later to put this in my trust fund for the second hair transplant that I'm eventually going to need, because, some people think, oh, I want to go in and get the hairline in my 20s. That's probably not going to happen. But if you, like you were saying, if you respond well to treatment, you keep what you have, and you do the research, and you get a great result process, maybe we can not maybe do your 20s, maybe 30 years old, just stuff you can do to, because I understand, I'm there myself. I'm a normal guy, and I feel like most of these people that are saving up for hair transplants are it's pretty wealthy, because it's a pretty expensive deal.
There's a big population of younger, and there's a growing population of younger patients who are saving up for hair transplant, or who are hoping to travel across the world to have a less expensive hair transplant and for it to be successful. Back when I started in the field, what's going on, dude? Back when are you?
Back when you started.
Are you listening to a cartoon or something? What's happening in the background?
No, my brother's he's a guitar player, and he's learning soul music because he just joined classic funk band. So we I was walking past. Apologize for that.
Yeah, but to try to make this long story short,
turn off his amp.
Yeah.
Yeah. Right.
When I started, the average age of a guy having a hair transplant was around 30 to 32. It was a totally different world, because you had to be able to afford to have the transplant. There were a lot of younger guys who wanted to have hair transplants, but they just couldn't afford it. Now the field is wide open, and there's a lot of cosmetic surgery tourism. So a lot of young guys are having it done, and when the younger you have it done, the more of a lower hairline you expect, the more you expect to look like you did prior to starting to lose your hair, the greater and less realistic your expectations are. It's a whole fucking problem. So, you're certainly right about that. But listen, man, we're going to take some more phone calls. I think that the message here The message here is don't panic. Let me tell you something. As soon as the news cycle starts to slow down, It's just going to be another thing. It's going to be major. I mean, listen, it's certainly affecting the global markets and the financial markets. It's certainly affecting people's day-to-day lives. There will be some small businesses that will go out of business. And I actually think that it may actually correct, to some degree, the trajectory of the hair transplant field, where the guys who are kind of living on the edge, robbing Peter to pay Paul, or the kind of slap shot, pop-up clinics, they may not be able to compete or survive this next couple of months. So this may be a good thing.
And I can tell you that I know from experience, like one business that is really suffering is the restaurant business. I know a lot of people in the restaurant business, and all of them are saying that business is way down. So that's one of the major markets that or industries that this is going to hit the hardest.
And if you don't mind, before you let me go, if I could just say a little closing thing, is that the viewers that are listening that had all their hopes up, don't give up. This is not going to be the end of the world. It's very serious. Do what you need to do to protect it. If you have to go out to the stores, if you can't afford gloves, just use your shirt, open up, and keep your hands closed. And at the same time, if you're young, listen to what this show is about. See where your progression is going to be, because you have to see how bald you're going to get. So don't just jump in there and it falls back. Because what I really wanted to talk about first was, man, those Try Guys videos. After the show that Joe did and going back, his hair, I was like, it's been at least like Joe's hair in the back of his head has grown so full since then. That guy looks horrible. But anyways, I need still got kind of something to talk about. Well, I guess I'll call back in the next show. But
well, yeah, we can definitely. I think that's going to be an interesting topic for another show. But for sure, man. I mean,
absolutely.
That's
that's
very interesting.
Everything you do, please be safe and listen to everything that's going on in here. These guys are the experts. They know what to do. Like, this is a serious time. Just don't panic, because panic is the worst thing you can do, because that is what leads to foolish decisions. That is why people get hair transplants at 22, because they're panicking on a ball. Would you agree?
I agree, man. That's a good message.
I agree.
I appreciate the call.
Thanks, guys.
And stay safe.
Great talking to you guys.
Okay.
Safe, and you take
Thanks
care
for
of yourself,
calling.
all right?
All right. Take care.
Yeah, thank you. Bye.
You are too nice, Joe. 888-659-3727.
Hold on. I just want to share this photo. It's like I was waiting for a moment to jump in, and there wasn't one. God bless him. So this image that is on the screen now, that was my local grocery store yesterday. And you can see there's just a couple of packs of toilet paper right on the left-hand side of the image. I was blown away by this. I've seen it online, and then to see it in my own grocery store, I was like, what the hell's wrong with these people? All the other shelves were stocked full of whatever was on them, like water, sodas, meat, all that. But God forbid someone doesn't buy their 500 rolls of toilet paper. It just blows my mind.
I got to tell you, there's some sort of sickness in this country with toilet paper. And like, there's this fear of not having enough fucking paper goods. It's ingrained in our country. I don't even understand it. It's like, all right, worst case scenario. Now, this doesn't sound too appealing, but there was a time before manufactured toilet paper.
Yes, there was.
There's a sink. There are towels and rags and things that you could certainly maintain your hygiene in an emergent situation.
Keep in mind, in some countries, they still don't even use it. They have a fountain that comes up out of the ground.
Yeah.
So there you go. If it's good enough for them, it's good enough for you in a time of need.
I was going to say something really fucked up, and I'm not going to say it.
Hey. Yeah, I know.
Phone number is 888-659-3727. But yeah, I mean, we're going to take your calls right now. 888-659-3727. But I want to make this clear that today, through the American Hair Loss Association, we were asked to provide an interim or clinical guidance for management of patient safety to some very well-known mainstream outlets and a government organization. And I think that really speaks to how prevalent cosmetic surgery in general has become, and the fact that this is not something that's being forgotten in the eyes of I'm not going to even mention the government agency, but in the eyes of at least the U.S. government and the mainstream media, that they know that people are going to go out and they have cosmetic surgery planned. And, they want to know what the details are. For some reason, there are doctors who are not speaking about it. I spoke to this one reporter who said that the two go-to people that they normally talk about when it comes to plastic surgery did not want to comment. And I'm thinking, what an incredible opportunity to tell people everything's okay.
I was going to say the two people that they wanted to comment on this were isolated in quarantine with coronavirus.
They might have been. I think there's such a fear and a panic that this is going to set the entire cosmetic surgery industry back a year. And I will tell you that, it's funny, at least in this industry, these guys, so many of these guys are so fiscally irresponsible that they probably do live month to month.
Which is amazing. Yeah. No, you're absolutely right.
And so I'm assuming that, listen, if you can't make your payroll, if you can't make your payroll 6 months in advance, if there's some sort of a calamity, you're squeaking by in business.
Yep.
That goes for any business. But in this industry, I've never seen people panic so easily. Just saying. So I definitely think this is going to kind of, cull the herd?
Yeah, cull the herd. Exactly. I agree.
And I think this is obviously it's not a great thing, but it could be a really good thing for the hair transplant industry and for consumers.
Yeah, I was going to say the herd that is the hair transplant industry, not the human race.
Yes.
Just so that's clear.
Yes. We don't
if you're just tuning in now, we're not talking about culling the herd of the human race.
No, we are hoping that no one gets ill, and obviously we don't want anyone to die. We're talking about people who are not going to be able to stay, in business in this industry. The fly-by-night guys, the guys who are living, paycheck to paycheck, essentially. The guys who are living payroll to payroll every month. The guys that cannot pay their bills, whose credit cards don't go through. Those guys.
Yeah.
Like, I've been in business since I'm 19 years old, and I'm not saying I'm a fucking genius. But I know one thing, that you do not have a sustainable business, a robust business, if you cannot make payroll for at least 3 to 6 months without bringing any income in.
100%.
888-659-3727. Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from?
It's Morty calling from Corona Central, New York City.
Morty!
Hey, Morty!
Listen, I saw your boy,
What's up,
Comrade de Blasio, on the news today.
Oh, jeez. Oh, God.
And in a million years, I never thought that he would actually publicly be in agreement with anything that this administration has done. Anything. Mm. And he actually stated that he agrees with the travel ban in this circumstance. Mm-hmm. You know what that means? That means all hell is breaking loose in New York.
Yeah, 100%.
There's 400 cases here already. It's kind of crazy.
I'm not going to say this publicly because I don't know if it's true or not, but there's someone that we all know in your city. Do not mention any names, Morty. Don't try to guess.
I won't.
Who may have corona?
Well, whoever it is, God bless him. Hopefully, he's not in that age group where it's really an issue. Because if you're over the age, from what I'm hearing, over the age of 40, that already counts against you as a risk factor.
Well, let's put it this way. Let's think. How can you actually put a number to that?
It's all of us, man. It's not just me. It's all three of us.
Listen, I really think it has to do with having certain underlying conditions, your immune system, and where you are in life and your health. Most people who are over the age of 60, 65, sadly, one thing that they don't talk about much when it comes to this virus is Besides smoking, one of the biggest risk factors that Americans are dealing with is the obesity problem. And if you are overweight, if you are obese, if you're considered even 10, 15 pounds overweight, your immune system is compromised, and your ability to fight any infection obviously is compromised, because your body is dealing with all kinds of different things, like possibly type 2 diabetes. Your medications aren't going to be as effective, on you. So these people are at risk. So I would say if you are obese, if you're overweight and you're 30 years old, you are at greater risk than someone who's 55 years old. I say 55 because I'm going to be 55, who is in good shape.
That's true.
I believe that for sure. I mean, look, I could drop dead from this thing.
Well, it's true.
Who knows?
It's absolutely true. Yeah, I mean, the bottom line is that I think that it is. First of all, it's great that the mainstream media has come to you and to the American Hair Loss Association to ask these questions. It's kudos to the reputation and that you've created and the recognition that you've created over the years, and you're definitely the right person to answer this question.
I appreciate that.
And
Yep.
and same thing goes to you too, Joe. I mean, both of you guys are coming at this with a level head, and I think that's really what needs to be in this particular case, because it's serious business.
Well, what's crazy about this is, and I'll just say this real quick. Even in times like when we have this issue of COVID-19, coronavirus, call it, Wu-Tang Clan, whatever you want to call it. Or that's my little joke about the Wuhan virus. It's Wu-Tang Clan. But what really pisses me off is when people start losing their sense of humanity and what's the word I'm looking for? They
Stampede to get toilet paper.
No. They revel in the idea of someone potentially having the virus. I saw someone online, like on Facebook. There was a story about a particular individual. I'm not going to get into it because then we start getting into politics. But a particular family member of a politician potentially having come in contact with someone that was infected, and some asshole said, "This makes my day." What kind of fucking animals are people out there? It's like, that just blows my mind. So, I just want people to keep, not just a level head about the virus, but stop being assholes about people that you may not agree with. It's like, just be a human being.
Well, I said this in the WhatsApp group that I think that this is really a time of reflection for, and I don't mean to be all philosophical and fucking, spiritual and all that shit. Maybe I do, but I definitely think that it's a time to be reflective. When you're really thinking about it, when you're panicking about the industry, when you're panicking about what can potentially be happening to your family, but especially in this industry, the guys that are worried about losing or patients postponing, and they've lost 5 cases this month or whatever it is. Just step back, people. We're talking about people, human lives here. We're also talking about the fact that, a lot has been done in this industry that might not be considered to be, what's the word that I'm looking for? What someone of integrity would do.
Yeah.
And, maybe this is just a time to say, what? We could stop a little bit. We can talk to our patients. We can call our former patients. We could spend time, have our staff do stuff in the office so that you feel at least, okay, we're paying our staff to do something. Have your staff contact former patients to see how they're doing. Follow-ups. Have your staff make calls to, patients who came in for, prior consultations to see, if what they're considering doing. There's a lot of ways to make use of this time without panicking. And also to better to better their facilities, to really take a look at things, if that makes sense, Joe.
It makes a lot of sense. And there are other things, like one thing that people don't think about is if a clinic is being unused for a number of days, it needs to be scrubbed down again because of any sort of airborne particles like dust and things that are floating through the air. They start settling on it. You got to keep the clinic clean on a constant basis. So as we used to say in the restaurant business, you got time to lean, you got time to clean.
Hmm. I can tell you this:
Mm-hmm.
I had a doctor's appointment set up for this afternoon to have my just annual physicals.
Yeah.
I'm sorry, Joe.
I love
And
your
I agree with
responses
you.
to these deep thoughts I bring out. You're like, Anyway, so it's like,
Well, I think that's pretty common. I mean, people, especially when they call a show like this, they're thinking about what they're going to be saying next. You know,
and I heard what you said, Joe. I think that cleanliness is next to godliness, and it's certainly true if you're talking about a surgical theater. I mean, I agree with you.
You should come to my place. It's ridiculous.
and since we got Morty on the line, Morty, can I show your update on your haircapades?
Oh, sure. Why not?
Okay, all right. So 'cause I asked because
I like that.
someone in the
Sure.
chat room was asking when you're going to share an update. So here we are, everyone. On the far right is before, and on the far left is 3 weeks ago. This is Morty's hair restoration journey, non-surgically.
Yeah.
And that's pretty impressive.
Now
That's using finasteride, laser.
You have to really take a look at the before.
Ketoconazole, yeah.
Because, and I've said this before, is essentially like a block of Formica. And you would think that nothing, like nothing would grow out of that.
I love that. Oh, that's hilarious.
You know, and no, I'm saying, but that's significant. I think it really gives people hope that no matter how far gone you think you are, when people are saying follicles are dead, follicles are, in most cases, are always growing. They're always generating hair, even though it's vellus hair. It may be invisible to the naked eye. There is a chance to reverse that miniaturization, and if you are a good responder, and you are, you know, I mean, this is very reasonable. It's pretty impressive, but there are people who will start at the point that you started, Morty, and I've seen this. It's rare, but they'll grow back their entire mid-scalp, or they'll grow back a crown, or they may actually grow back a hairline.
Yeah, well, I mean,
Morty's got his forelock back, which is amazing.
Yeah, no, I'm very impressed with everything that's happened so far, guys, and it's thanks to you guys, you know, basically holding back and letting things, you know, take their course. You know, and by the way, guys, finasteride is no cure for the coronavirus, so, you know, just keep that in mind.
Well, I have to tell you this, you know, FSK in the room just asked if I've stocked up on concealer. As a matter of fact, I have. I was sent almost like a truckload of concealer years ago. I think it will last me a lifetime, for sure. But what I did do is, even though I take one 5 milligram finasteride pill per week, and I normally don't like to stockpile the finasteride because it has an expiration date, and even though I know that expiration date is probably not going to affect the drug for many, many years, because it's my hair, I prefer not to take expired ProScar. Now, that's just my own, you know, but I have a lot of it just in case. But what I decided to do is I decided to get my monthly refills as opposed to waiting. And I just have a refill waiting for me. So for the next few months, I'm just going to stockpile my finasteride or my ProScar as well. I also have an irrational fear that Merck may stop manufacturing brand name for a while if, in fact, you know, things continue to go down like they are in China, because a lot of the components of our drugs are manufactured in China. And almost all of our...
That's actually really frightening.
Almost all of our antibiotics are. So think about that. Think about if they just decide, you know what? Go fuck yourselves.
They actually threatened that yesterday, by the way.
How is this country not prepared for that? When you think about it, and how, you know how this has happened? It's all dollars and cents, man.
Oh, I know exactly how it happened. I know when it happened.
Clinton.
Exactly.
Yeah. We're old, dude.
Anyway,
we're not getting into politics here, but yeah.
We're fucking old.
All I can say is that, I mean, this country's allowed itself to become a single supplier. I mean, this happened in the 70s with petroleum. We've learned our lesson. We're the largest producer of petroleum in the world now because we got hurt so badly in the 70s. This could be a wake-up call for, lots of different things like, I was watching Joe Rogan had a guy on who was talking about the 16 essential medications in the world. Like there's a list of them that some UN or sub-organization puts together, which in order to have a health system, you have to have these 16 medications. And almost all of them the United States uses come from China. And these are essential medications. Now, as much as we think for us, finasteride is pretty essential, it certainly is for all three of us on this call, I don't think it's on that list. But again, whether it's finasteride itself or the chemical components necessary to manufacture, a lot of it comes from China. So your fears are well founded, Spencer.
Well, I will say
totally
this, that there's no doubt, and at least love him or hate him, at least his administration has made a point of focusing on this. I definitely think that this virus, the coronavirus, is going to spur U.S. efforts to remove the chokehold that China has on our drug supply. And it may take a while, and people may die in the process. But I think that it's going to happen. And I think that there's going to be a lot of new manufacturing opportunities and jobs that are going to be created. I mean, this isn't necessarily going to be all bad. I think that this has become a very real circumstance of this pandemic. And that this country does not want to have the fear that they're fearing right now of being kind of left with their fucking pants down. So let's hope it happens.
Yeah, Spencer, I'd like to basically say, your advice for for the hair transplant surgeons out there to reach out to their previous patients and actually to the patients to come, and just kind of let them know that you care is certainly valuable. I had an annual physical scheduled for today, this afternoon, and 2 days prior, my doctor called me and said, "Look, are you sure you want to have this physical now? It's okay if you postpone it. As a matter of fact, I would suggest that you do, because having you come into a doctor's office right now is probably not, if you can avoid it, if it's not anything that you need dealt with immediately, put it off for a month." And I think, sure.
The only reason he called you is because he doesn't want you in his fucking office. He's afraid of getting it.
Well, that's probably also true. Yeah.
I get that.
But the fact is that that's a good piece of advice to reach out to your patients. One last thought, and this goes back to the reason why my hair looks the way it does now, going on 2 years later, to remind everyone who's listening that surgery is the last resort. If you have a hair transplant scheduled, okay, and you are on the fence about it, and you've heard from these two lovely gentlemen here, Joe and Spencer, and they have told you that you should, think about it. This is a good excuse for you to call that provider and say, "Hey, you know what? Coronavirus, I need a month. I need however much time," and then spend that time thinking about whether you really need this. Because it's kind of a nice. It gives you a little bit of a break. I actually had something scheduled myself for later next week. I postponed it for a month, and it was precisely because the provider that I was using would require me to enter the airport to travel, and I just did not feel like going through an airport at this particular point.
Well, look, the way that I feel about it is, and I'm obviously pretty candid as a person, and especially in this business. This is a tremendous opportunity for the really good doctors, and anyone who's concerned about someone taking a month or postponing their surgery, anyone freaking out over 4 or 5 cancellations, probably is I would say probably should do something else for a living. That's how I feel about it, because this is medicine. And if you and if you're not really, first of all, if you're halfway good at what you do, there's no way, and if you've been practicing for a while, there's no way that you shouldn't survive 2 or 3 months without performing surgery. Take the time to take a vacation. Take the time, like I said, to contact your patients. Make sure that your office is in tip-top shape. This is an opportunity to go through all of your records, to clean house, to purge, and to really have the opportunity to concentrate on moving to the next level when this is all over, because it will be over sooner than you think. So instead of all you doctors who are watching the show now or listening to the program, this is an incredible opportunity for you guys to move to the next level. Rethink some of the shit that you've done for the last 10, 15 years. Rethink some of the evil that you've supported over the years. You know?
Well, Corona's going to come and get you.
Yeah, it's time to put patients before politics. And I see this, to me, honestly, and in my business, listen, this is my business. I see this as an incredible opportunity. Now, of course, I wish it didn't happen. I wish people weren't being harmed by this virus. But you got to take it for what it is, man. And what it is, like you said, it's an opportunity to reset. You know, kind of take a look and see what's really important in your lives and in your practice and in your business and as patients and what's important for you. Do you really want to have a hair transplant? And if you do, what's the difference? Surgery's going to be there. You can wait 3 weeks. You can wait a month. Or if this is the only time you can do it, just make sure you ask the right questions. Make sure that everyone in that clinic is suited up. Make sure that there's been no one diagnosed with coronavirus that has stepped foot in that clinic. And these are all questions that have to be answered or should be answered honestly if they're asked to the physician and to the practice. And you know what? If you call someone's practice, you shouldn't be getting responses from their fucking receptionist. No offense to the receptionist. The doctor should get on the phone and speak to you personally. This is a time when they should make a personal connection with patients and prospective patients.
And I'd like to add to that I think that if a lot of clinics and doctors did take some time, like if they do have some downtime because patients are canceling, or if they voluntarily shut down for a week or two, I think it would be almost like a learning experience to slow down and get back in touch with former patients and learn just how much appreciation they'll get from those patients because they're reaching out to just check on them if they don't normally do that. Because I know for a fact that when patients are clinics are proactive about this, patients really, really appreciate it. And if a clinic isn't doing that and they take the time to maybe step up, then that will improve their practice for the long term.
Look, the smart doctors are going to be able to, they see the possibilities here, and they see that, you know what, now we really have the opportunity to separate ourselves from the rest of our fucked up colleagues.
Yeah.
And I think it's, it could be tremendous for this field. You have to make lemonades out of lemons here. I think that this could be something to really catapult the change that we really needed in this space. Morty, listen, always appreciate the call, man.
Absolutely.
Guys, I appreciate you guys. I appreciate this every week, and it's always great to hear from both of you.
How's
Joe,
my hair,
take care
by the
of
way?
yourself and Spencer. It looks good, man. I'm liking the new light on top. You got a nice reflection, a nice sheen going on.
Thank you.
And Joe, as always, perfectly coiffed. Both of you guys stay safe. Avoid large crowds, wash your hands, all those good things.
Dude, I'm going to Vegas, baby. I can get a room for $129 at the Wynn right now.
I'm flying to Italy and running naked through Il Duomo.
You won't be running into anybody, from what I could tell. Huh?
Exactly. Yeah, I can get away with that. Yeah.
All right, Morty, we're talking. All right, take care. Be safe.
Take care.
Okay. Bye-bye.
See you, buddy.
Bye.
Hey, guys, the phone number is 888-659-3727. That is 888-659-3727. I hope, at least for the physicians who are listening to the program, that what we are saying makes sense to you. I'm not saying to exploit this as an opportunity. I'm just saying that, you have to look at this as an opportunity to reflect and to affect change, because it's there. It's waiting for you. The good guys will prevail. The good guys are going to be the ones that are going to thrive in this environment and going to leverage this in their best interest. And my hope is that some of the usual suspects don't start to do coronavirus sales. It's very, very possible. There's a guy in L.A. that I remember when in 2008, during the big financial crisis, guy was running fucking like Black Friday sales or whatever it was called, Black Monday.
Are you at high risk for COVID-19? Make sure you look your best on your funeral day.
Do you think, I mean, honestly, you cannot put it past these guys, man. I wouldn't put it past these guys.
But wait, there's more. Act now and get a free penile enlargement.
Oh, my God. Oh, my God. Let's see who this is.
It's out there.
Hey, you're on the air. Who's this and where are you calling from?
Yo, what's going on, guys? Steve from Arizona.
Steve from Arizona.
What up,
What's
Steve?
happening, man? How's it going over there with
what's up,
Corona?
I fucking ridiculous. All these scared rabbits running around with their fucking Michael Jackson masks on and shit.
It's pretty insane.
That's good.
Recently, just in time, they closed all the goddamn places this week. But last week, I went on a trip with my daughter and brought her all around, California, did all the parks, Knott's Berry, Disney, all that stuff. And so we went last Tuesday, and I wasn't even thinking about it. Like it was in the back of my mind because I had heard about it, but I'm not even thinking in these terms. And so I'm a little under the weather right now. I can hear it, but I was actually Monday night because we left Tuesday night. I was getting real sick, and I was like, "You son of a bitch!" Right when I'm going on this vacation, right? Naturally, and I was getting the chills, like a fever, everything, and somehow I was able to, whatever reason, stave off the symptoms until I got back, which was last Sunday night. About Monday, like that, I started to, it started to break. Like, I started getting congestion, really tired, felt like crap, all that kind of stuff, but made it through the trip. But on the way there, it wasn't so bad. Like, with the people, it was a few people with the masks on and stuff, not many. Only the real weirdos, like, you can just look at them, like, even in their, if everything was normal, they wouldn't be,
Yeah.
So, anyhow, it wasn't bad. We go to Disneyland and California Adventure, Knott's Berry, Universal, all that. It wasn't too bad till towards, like, the last day. I think we went to Knott's Berry on the last day, which would have been on a Saturday. To Santa Monica Pier on Sunday. And there was some there, but when I knew that it was going to be like this is when we got on the plane on the way back. And I get on the plane, and there's a ton of, it was like packed house, and a ton of people were wearing those like face masks and everything. And we're going through, because naturally we had to be one of the last people who were boarded. We were the last assigned seating or whatever, Southwest. And so we're walking through the aisles, and a couple of people on the way back were like, "Oh, here, did you want any wipes on your way back?" I mean, we had sanitizer on us just because I don't want some little snot-nosed kid who.
Well, my question to you is, and I don't mean to interrupt you,
Yeah.
but I mean,
No, go ahead.
did you get tested for coronavirus, and did you end up passing it on to many people here in California?
I tried to, but no, I didn't. I didn't get tested for it. I mean, getting back to that in a second, but for all we know, because there is a lesser symptomatic version of it. Well, it's the same version, just you don't respond to it poorly. I could have it right now.
Well, that's the thing. You could have it
yeah.
right now, which would be interesting.
Absolutely.
To know if you did have it.
I could have it right now.
And essentially, you're a guy with coronavirus calling the fucking radio show.
There you go. And I could.
There
It
you
very
go.
well could. And it could be on the tail end of it. I mean,
coronavirus is really
flu.
common
No.
in the wild. There's like multiple strains of it. It's just this strain just happens to come from a wet meat market that is right across the street from a bioweapons facility, and it just happens to have some DNA from HIV, H1N1, SARS, and MERS. What's to be concerned about?
Yeah, not much.
But it's interesting. If you look at the back of a Lysol,
I'm just kidding. I'm kidding. I'm kidding.
If you look at the back of a
I know.
Lysol container, it actually says that it kills coronavirus. Now, that's nothing new.
Yeah. Don't start
and
drinking
so,
Lysol,
I mean,
people.
I look at it as just some bullshit trumped up flu. I mean, yeah, if you look at the numbers, the purported numbers anyway, they're at what, like 3% death rate, where the flu's like 1.5%. And you may say, oh, well, 3% is double. That could be because we don't have a flu shot for that for people who are really susceptible.
Yeah, but it's
to
also
something
because
like
they
that.
don't really have the numbers. There's a guy, you're calling in the fucking show saying you were sick. You could be one guy that's not, you know, in the
and I'm
stats.
not going to go get tested because I don't give a fuck. You know what I mean? And so I'm just not going to.
Okay.
And so, yeah, that's where I'm getting at, though, is that even if we just take those numbers at face value and say, okay, there's no flu shot for it, which would make it a lot lesser, or you wouldn't even get it. Well, flu shots mainly for people who would be susceptible to getting, you know, have a lot of immune system damage from it and maybe not be able to make it, like some, you know, elderly people or somebody who's in bad health. Well, since there is no shot, maybe that little extra percentage bump is from people like that getting it, or would be, because these are all kind of guesstimate numbers that they have. But anyhow, so on the way back, like, I'm trying not to cough on the plane. The cough's coming on a little bit at that point. And I'm like, oh, I don't need this shit, you know. So I'm trying not to cough, even though like I'm feeling it.
They'll lock your ass in the lavatory on the first cough. Get them.
I don't need it, right? Yeah, exactly. If it's any more than clearing your throat. So I was like, okay, whatever. A person next to me, well, I have my daughter, but the lady was like, oh, another one? Do you want hand sanitizer? Do you want wipes? Do you want this? Do you want that? And I was like, well, I'm already sitting here. She said, well, I have them just in case. Everybody, and at least, I wanted to start teasing about the people wearing a mask, but there was too many people close to me to do it. And so I was just like, I looked at my daughter, who isn't like that. She has the benefit, you know, might be tooting my own horn, but she has the benefit of being able to grow up around me, somebody who's sensible, who is not going to go to the grocery store and buy 9 cases of water because someone said something, you know, in the media or whatever. So we were both rolling our eyes at all these people on the plane, and we can hear them all talking about it. That's what I knew Sunday night. I was like, oh, this is gonna like get to this point. Like, we're just there now. Well, and sure enough, what was it, like 36 hours later that happened? And like last night, last night I was like fully like had a, you know, blow your nose every 2 seconds. I was coughing a little bit, and I was like, Christ, let me go to the grocery store, but I'm going late. There's a place called Winco around here. I don't know if you guys have that over there, but
no. Look. To me, I see this as it's a great opportunity to go to a restaurant, sit at a bar, and not have to wait in line, or not have to have a reservation. It's a great opportunity to negotiate a better price for a lap dance. It's a great opportunity, you know, to just, you know, see a movie. No one's going to be there,
and no one's going to sit next to me.
Yeah,
you know what I mean. As long as I sniffle a couple times, great. And
Joe, I say negotiate a lap dance.
I heard.
Okay.
What? Am I supposed to be shocked?
Come on, you know you got to give Spencer the pity laugh here and there for these jokes.
Every once in a while.
I didn't see that as a joke though. I thought it was serious. I was like, yeah, that makes sense. Yeah.
Jesus.
Anyhow, so last night, and this is how it is over here. So it's fucking raining like hell, about 9:30 at night, and I go to the grocery store thinking, all right, well, I don't want to go any later, but I didn't want to go with the madhouse that was like 5 or 6 o'clock, because I had driven by it. It's like a few minutes away from my house. And so I go up there, and I'm like, Christ almighty, well, it's not going to get any better than this unless I wait too late. I'm not going to do it. So I just go in. Tons of people with the goddamn mask on. Shit, paper bag, you know, plastic bag with the fucking couple people, plastic bags with like the hole in it with like a cheesecloth. It was so ridiculous. All the water sold out. All the toilet paper's gone. There's signs all over the goddamn store saying, please limit these items to 4 at a time. Hand sanitizer, wipes, toilet paper, tissue, you know, whatever. And it was ridiculous. Of course, people arguing over getting in a particular space where something's running out, whatever it was that was running out.
Yeah.
Like all the spaghetti.
Well, there was a video online
of
some women getting into a fist fight over toilet paper.
Yeah.
People are fucking animals, man. They really are fucking animals.
Yeah. And they're all, like I said, they're all like like these scared little rabbits. Like, guys, you take it at face value. It is all it is a different version of the flu. That's essentially all.
Yeah,
it
but
is.
listen. I agree 100% with you. I agree 100% with you. But most people, most people have two problems in this respect. Most people are sheep, for one, and number two, they believe the mainstream media. Like a lot of these more popular outlets are actually raising the alarm. Like they're elevating this simply for ratings. Like when there was a screaming doom and gloom. Yeah, it's like they give zero shits about people. They give zero shits about people. They just want the ratings. And I mean, I could go like I follow this and I could get into it, but I mean, ultimately, it's just people are sheep, and they'll believe anything that that most of the outlets are throwing at them. I happen to be a fact checker. Like I fact check anything that I think is worth catching my attention to read, and and the facts is that I mean this is like it was my opinion of to begin with, but when you look at the supplies of hand sanitizer, if they have any left, they're going for 3 times the cost. Like I was in the store last week, and they had these baskets full of bottles of hand sanitizer, and each bottle was going for $15. That's not normal. And what people don't understand, it's like you don't need hand sanitizer. Simply go to the sink and wash your damn hands. The rule of thumb is sing happy birthday to yourself twice, and that's the amount of time that you need to wash your hands thoroughly, and then you're done. Guess what? No virus. You don't need to stock up on hand sanitizer. It's a waste of money, and it's not a necessity to get through this.
Mm-hmm. Yeah. No, none of it practically is. Like back in November, so I watched a lot of NBA. Back in November, every team.
Not anymore.
I guess it could have. Yeah, right. But I did. Yeah, and I will in a few more weeks. But basically, back in November, there was a virus going on. What could have been that? Whatever. But let's just say it was just a regular strain of flu, and that was going around. And so everybody had 2-3 players out, like in succession, like on every game. Now this would have been no different. And what it's going to take for people, like you said, because they're sheep, to get back to normal and stop acting fucking ridiculous, is they're going to have to see people they know have been tested and had it, or suspected, well, they probably had it, and then get over it like in your typical 5-day fashion of the flu. You know what I mean? Or a celebrity, because that's what they're watching. That's why they're getting freaked out, because they're watching the media. We have more media now than ever, so people are even more freaked out. And so there's the people who run it too. Like like we have.
Dude, I'm going to interrupt
feminist
you.
Media.
I'm going to interrupt you and just say that what I consider this, it's been listed by the World Health Organization as a pandemic. To me, this is a fucking infodemic. It's just like Joe was saying, it really ends up just being about mass media, about media and getting the eyeballs. And, listen, right now, if you go on CNN, MSNBC, Fox News, it's corona. I mean, there's a lot of other shit happening in the world. It's coronavirus 24/7. That will only last maybe a week, 2 weeks at the most.
Yeah.
And then it's still going to be happening, but it's not going to be in the forefront of people's minds, because the media is going to go on to something else. It's going to go right back to the political climate and to the elections.
Exactly.
And they're going to be focusing on some of the aftermath and some of the carnage that this infodemic. I think that's I'm going to coin that phrase. This infodemic has really brought to this world into the entire economy, because it is social media, it is the mainstream media, and frankly, the facts of this disease, the facts of this virus, don't match up to the fucking insane panic.
Yeah.
And that's just
I think
the
for
reality
me-
that people have to understand.
Well,
Now,
let me.
I don't know
Okay,
if you guys are
so there's
on
someone.
board
Hey,
with
hang on a
this.
second. Go,
Yep.
Steve, hold on a second. So someone in the chat room just said, he said, LOL. So all news channels are fake. I think you're in denial. So I just went online, and let me pull it up. I'm not going to share where it is, but I'm just going to say, why is this? Oh yeah. So here's a headline: American life comes to a halt. What a crock of shit.
I will give
What do you mean? What do you mean it's fake? This is the real. This is not a big deal. Like, we're here. I can go to the grocery store.
Yep.
Everyone's going to the grocery store. Everyone's getting gas for their cars. You know, it's like, how can a story like that be taken credibly?
Well, I'm going to give you.
There's some restrictions, but it's not come to a halt.
I'm going to
It's
give you just
ridiculous.
one brief example of how I know that the media is sadly really just, they're really in it for eyeballs, and it essentially it's a business. When my brother was killed, I was, this was back in 2006. I got a lot of press because I started to do a radio show locally on WGFK FM called Highway Justice. And it was essentially a show about me investigating the investigation of my brother's death that was being conducted by the local police department and the state's attorney's office, so on and so forth. So one of the news organizations contacts me at the very beginning, right after my brother was killed, and I give them all the information. And this guy says, "Oh, I thought it was a hit and run." I'm like, no, we know who did it. And he's like, "Oh, really?" He goes, "Yeah, that's too bad because it's the story seems to be it would go much further if it was a hit and run." I'm like, "Well, it wasn't a hit and run, and I would love to expose the person that killed my brother, this and that." Long story short, they ran it as a hit and run piece. Yep. They completely fabricated the story. This was on local Fox News.
Yeah,
Not surprising.
But
it's all about sensationalism.
And it's happened to me in the hair world as well. So it's most of it is bullshit. It is bullshit. It is bullshit that's sprinkled with a little truth, a little bit of the facts, but it's mostly a story. It's a narrative that's created to create interest, to get eyeballs, and to pay the fucking bills.
Yeah, and I think part of it, what I was going to say, kind of goes with what you were saying about your brother's death. Like, I think with this ridiculousness, which is nothing compared to what you were going through at the time, I think people, they want to think that they're going to be a part of something big at some point in their life, and this might sound sexist or whatever, but we have a lot of in the media and everything, and feminists have taken over, right? We all know that. And a lot of these people who watch TV and give these programs ratings are going to be, older people who don't know any better, and a lot of
camera went out.
Women, housewives, stuff like that. They're not doing anything. They want to be part of something big. So what are they going to do? That's who was at the grocery store. I mean, I was there by chance because I needed a few things, but that's who had the mask on. That's who was fighting over, the last package of spaghetti. That's who was doing that and freaking out over it. A lot of it.
I saw this
exactly
woman pushing a basket who was so full of silicone. I mean, from silicone orbs in her breast to her face to fillers and all the stuff. She's running around like a maniac trying to grab whatever she can. I saw her having like a couple of some words with this woman. I'm thinking to myself, Jesus, man. I mean, this woman is taking a tremendous risk with her life with all the shit she's injecting into her body. And she's panicking over this fucking virus. So, listen, this...
Yeah, people want to be a part of something big, so they make it into that. I got to go to the store. We got to get 1 million gallons of water and stock up and start boarding up the doors. When I start boarding up the doors, is not when somebody has a sniffle and a chest cold. It's when it's like the movie Outbreak or whatever, where their eyes start bleeding and all that kind of stuff. Like, yeah, okay, then I'm with you. But until then, it's just absurd.
Well, look, I will admit that I filled my tank to make sure that I have a full tank of gas. I made sure I had a little cash. just in case some crazy shit that I don't think is going to happen. But that's about it. You know, like if I need to get out of LA,
I
I'm
understand that.
ready to
Like,
get the fuck out.
Yeah, like if something's already like closed down or the lines are too long, hey, you want to fill the tank up right now?
Yeah.
Kind of like somewhat beat the rush or beat the craziness, which is already getting crazy. But yeah, it's the same exact thing. I'm with you guys 100%. I think where are we at? We're at like a few days into it it's now it's a pandemic and shit's closing down. Like I said, I went to Disneyland just in time. As soon as I got back, it was closed, and all those other places now schools are starting to close and all that. And I look at it like, okay, we're a few days into it. How long until people get jaded by it and they knew someone who knew someone or the celebrity came out and said, oh, I had it, and it lasted a week and I'm cool. And then people start coming down from this high of wanting this
what's going to happen is
wanting something big to happen. 2 weeks.
As soon as the mainstream media ratings start to shift, then they have to shift the narrative. They have to continue to keep those eyeballs. Right now, there's a huge spike, just like there's a huge spike in social media as far as social media being used to promote this message and the fear mongering and all this stuff. It's going to change. Then we're going to be on to the next thing. I'm telling you, you give it a week, and you're going to see things starting to die down. Within 2 weeks, we're just going to be talking about the aftermath and kind of the lingering issues.
Yeah, and then anybody who was wearing those retarded masks and running out and filling the back of the truck with as many cases of water as they could won't be admitting that they were doing it. They'll be the ones, oh, yeah, I remember that. Everybody was going crazy except me. Meanwhile, they're the ones who were in the store doing all that nonsense, fighting over, the last.
But the sad part is
or whatever it was.
There will be more deaths, and there will be more people who are sick, and there will be people who are in a panic, and there's going to be fewer hospital beds, and there's going to be, people who are, scheduled to have elective surgeries, not necessarily cosmetic surgeries, but hip replacements, things like that. This is all going to be something that they're going to have to wait for. Not necessarily because of the pandemic, but because of the panic.
Yeah,
and that's
the main fallout.
But the panic is reality. I mean, that's it. Doesn't matter what about the disease. Doesn't matter. Perception is the reality, and that's why things are happening the way that they are. Yeah. So it's not going to change for a while. I think that the news is going to change. I think that it's not going to be as prevalent and as breaking news, new case found, that's going to die down, and then we're going to go on to the next news cycle. However, people are still going to be suffering.
Yeah, I mean, it's perception. That's the main part of the panic. Like, it just goes back to how did it really affect me? It doesn't, because ultimately I'm just not going to be deterred by it. But in some small sense, like when I got on that plane, I was like, oh, let me not cough. Somebody might detect something. I don't want everybody turning over the seat to see. But I'm the kid who came in late to class, and everyone turns around and stares at you.
I just wanted to make sure that I had a bottle of Jameson's and a full bottle of pills in case I had to off myself. If all hell breaks loose, if we have Corona zombies running around. So,
right.
Yeah. So listen, man, we're going to take another call. Always a pleasure. Right. I'm glad you're feeling better. Right. It would be interesting though if you got tested, if you can get a test to see if we actually had a guy with coronavirus calling in the show.
That'd be cool.
Yeah, I would, and then let you go. I just feel like burning the time up.
Yeah, you know what? Maybe they'll come out.
If anybody gets it around me, then we know who probably gave it to him.
That's true. Well, let us know. All right. I'm glad you're feeling better. All right. Take care.
All right, guys.
Bye-bye.
Take it easy. Bye.
Good night.
Phone number is 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from?
Hi, Joe. Hi, Spencer. This is Tim from Germany. Oh, sorry, guys. The fumes from the adhesive from my hairpiece got into my throat, and I had to cough a little.
Oh, okay. That's hilarious.
What's happening, man?
So I'm calling from Corona Center, Germany here.
Yes, tell us.
Last night was the press conference from Angela Merkel. She even looked concerned for a change yesterday.
Yes, finally. I saw that.
Finally. Yeah. Well, we're getting along.
Well, so tell
I work for-
so tell us
I
what's
work
going
for a
on.
cruise ship company. We're fucked.
Oh my God, yeah, I can't even imagine.
Oh yeah.
You guys want to book a cruise going to Europe?
We'd have the ship to ourselves.
Yeah, we wouldn't be able to travel to Europe.
Yeah, you could cross the Atlantic all with the crew. You could party with the crew, with a bunch of Philippines.
That's right.
I'm telling you, I'm not joking. I was just looking at rooms, and I like the Wynn, and it happens to be one of the more expensive hotels in Vegas. And at least last night, and it's probably going to be cheaper, they were $129 a night for a suite at the Wynn.
That's
What's the usual price?
600,
I have no idea.
And this is Vegas rooms are usually less expensive, but I would say about $650.
So you could even take some snacks out of the snack bar.
Yeah, absolutely. You could drink the entire. You could pull a flight. I don't know if you saw Denzel Washington in Flight. That was a great movie. But I mean, you could drink the entire minibar.
Yeah, you should do that. But what I wanted to talk about with you today is I have seen you have been quite active on Instagram lately, Spencer.
Yes, I've been working hard, man, trying to make it happen.
Doesn't that shit look good? That shit looks good. Good images.
Of course it does. Yeah, you should continue on with that. I was asking myself, have you ever considered being guest on one of those millennial talk show podcasts, like H3 podcast or Joe Rogan or something?
They'd have to ask me. Of course I would.
Yeah, they got to ask.
So Joe Rogan didn't ask you.
Not only did Joe Rogan didn't ask me, I saw him in a restaurant the other day, and I don't think I'm crazy because I have been in contact with this guy in the past. He recognized me. I'm telling you. Maybe I can't say for sure, but I'm pretty sure he recognized me. Now, I didn't want to go up to him and his party and bug him, but he was watching me as I'm sitting down with this beautiful woman at the table. And I saw him looking over at me, and I gave him a knowing look, and he just kind of like looked down. I was like, all right, okay, man, I get it. You're a big famous dude. Totally get it. No. I mean, maybe he...
Yeah,
maybe,
big famous dude that's looking at you and be like, man, he pulled some nice, okay.
No, but I'm saying, maybe I'm thinking like, I'm not going to embarrass him and say, yeah, remember me? We were in contact. You said you used to listen to me on the radio here in Los Angeles, and you want some insight about your scar. Maybe he doesn't want people to know that, so I didn't bug him. But yeah, I mean, I would say that he knows who I am. So if he really wanted me on the show, he would contact me. But I don't think it really interests him. He may talk about his hair transplant once in a while, but I mean, he's got a lot more interesting guests, I have to say.
I think that he would much rather forget that chapter of his life, the hair restoration. He doesn't want to be reminded about it.
You guys are very interesting for my age group, like millennials and stuff. People just don't know about you.
Well,
I've noticed, for example,
thank you.
I'm a huge fan of the H3 podcast. I don't know if you ever heard of it. It's like a comedy channel. Ethan and Hila Klein, they made a podcast. They started like 2 or 3 years ago. And like most podcasts, they got these sponsors, and they're talking like 1 or 2 minutes about their sponsors. And sometimes they are getting sponsored for hymns.
Yeah.
And they're making little jokes and a little bit of talking about for hymns. And I think this might be a show. There's this comedic podcast environment, and you two guys who obviously have some comedic value in your show. This might be something to reach the millennials and get a wider audience.
Well, I would absolutely enjoy that. Did you say we're old?
Yeah, you're old. You're fucked anyway. There's nothing growing anymore.
I love this guy.
But there's still people out there who have a chance. Maybe you should consider it.
Oh, listen, I would love to do it, and I would absolutely take anyone's invitation and go on their broadcast. But they have to contact us. What am I going to do? I guess I could send out a press release, say, "Hey, listen, please put me on the show."
So here's
Fuck it.
what I
Spencer
did.
Coburn
I
announces
actually-
he's finally available for podcasts.
Yeah.
So here's what I did. I DM'd the producer of the H3 podcast, which you can find on Instagram as Swordlove. And I told him about you, and he said he's looking into it. So maybe Joe or you, Spencer, DM'd this guy from the H3 podcast, maybe he would say, wow, what a coincidence. 2 people asking about those guys.
Well,
And one of them is the guy himself.
Well, I'm thinking, not that I wouldn't do that, not that I am above contacting someone to put me on their program, but sometimes when you do that, these guys will look at you like, I mean, what are these guys, desperate to be on the show? What are they trying to sell? They don't necessarily, when you're dealing with the world of hair loss, the outside world thinks that we're all trying to sell something. They don't particularly understand it. And
You're not.
No, we're not. But they have to take a lot of time to figure that shit out. And when I started in this business 23 years ago, initially when the media would contact me, that was one of the first things. They wanted to know what we were promoting or if there was a product or a service we were selling. People used to think that they thought of hair loss, they thought of the hair club. And they thought that maybe I was involved with them or had my own type of a hair club. No one could fully understand that, there was this need. There was a whole bunch of, the largest demographic of all humankind suffering in silence. And this guy came out and decided to talk about an issue that society didn't want to talk about without selling something. No one could fully grasp that. It took years before the media really caught on to it. So I don't necessarily think that, I kind of understand why young podcasters or broadcasters wouldn't necessarily gravitate to us right away because they don't get it.
Yeah.
So, what I would suggest you do is contact them again. Say, look, I just called the show. They said they would love to do it.
I will send
Set
him
us
a
up,
link,
man.
send him the time mark where from this moment where we are talking,
Yeah.
and maybe he replies.
That would be terrific.
Sounds
Listen,
great.
tell him he'll be doing a lot of good and helping a lot of people out. And we don't rely on sponsors and we don't sell anything. So there's no money to be made for us to be on this program.
All right.
All right, man.
So, guys,
Thank you so much.
I'll leave you to it.
All right.
Maybe take another caller. Stay safe. Stay healthy.
You too. Thank you so much for the call.
Bye.
Okay, bye-bye.
See you, buddy. Hold your breath.
888-659-3727. Now, this is the German guy that actually, he joked about the hairpiece glue, but he wears a piece.
Yes.
Yeah.
Yes, that's it. That's his thing, and it works for him.
And I think
He's happy with it.
I think it's great, actually, that he's able to live his life without having that surgery. And, he probably looks great, but he's able to be self-deprecating about it.
Absolutely.
That's not easy.
Yeah, that was funny. It was a great intro on his part.
Yeah, it's not easy for a young guy. Phone number 888-659-3727. You want to take another call? Why not?
Sure, we'll do one more. Yeah.
Hey, you're on the air. Who's this and where are you calling from? Hello?
Hello?
Yes.
Yes, it's Jamie from the UK.
Jamie from the UK. I never would have guessed. How are you?
Hello,
man?
Jamie.
I'm okay, sir. How are you?
Pretty good, man. Pretty good. How's the UK handling the coronavirus?
Oh, just like yours. And where football's our main sport over here, we can't watch it for love nor money, so everyone's upset.
Wow.
Yeah. That's literally it.
And the thing is, you guys, besides football, your pastime is drinking, right?
Well, yeah, that's probably second best, yeah.
Yeah. So, I mean, are people
So they
staying?
usually go hand in hand.
Are people staying out of the pubs?
Yeah. Yeah, people are staying at the pubs. Tradesmen ain't getting a lot of work. Even people who cut hair, people too scared to get their hair cut. So, yeah.
Oh shit! I didn't even think about that. I'm in desperate need of a haircut, and I was thinking about scheduling a haircut. But my barber is like 70 years old. Yeah. Well, I guess if he's that old and he has corona, he's not going to be there. So
that's brilliant.
Yeah.
Well, I was calling to ask you guys. Basically, I mean, I wrote it in the chat earlier on, and I've been on finasteride for about 10 years now. I've started to notice my temple points as a bit of a recession there. And I was wondering if I should make the leap from finasteride to dutasteride. What's your opinion on that, guys?
Now, you're noticing a change since you've been on finasteride, or is it a slower?
Well, I've been on finasteride for 10 years, but it's slowly changed. But I've only recently. The change has only been recently, from the last year, where my temple points are starting to thin and sort of go back towards my ear.
I have a question for you. Have you switched your supplier of finasteride?
No.
Now, so how are you getting it? Are you getting from your local drugstore? Are you using brand name, or are you using a generic?
I'm using Proscar, and I'm getting them from my local trichologist.
Okay, good. So you're using Proscar. Okay. That's great.
Yeah.
And how much are you using? Are you cutting it into quarters, or are you taking an entire tablet?
Just cutting it into quarters. One time, like taking 1.2 a day, sort of thing.
So again, I can't give you medical advice, but my advice would be to speak to your doctor before jumping on dutasteride, and maybe up your dosage. And again, get the information from your doctor. Go over it with him or her, and consider upping the dosage of finasteride before you jump over to dutasteride.
How old are you again? Did you say?
Oh, I'm 27.
27. You've been on it for how long?
10 years. 10 years.
Wow. Okay, so you got started really. Okay, so
yeah.
One of the things that I hear a lot is, what should I do? My finasteride stopped working.
Yeah.
And that's not really like finasteride. It doesn't just stop working. Your body doesn't build up a tolerance to it. Your body doesn't start to, counteract its effects by upping the DHT production. It doesn't work like that. So what happens is, usually this is an indicator that your response to it isn't a complete cessation of hair loss. It's a very slow crawl, and you don't start to notice the changes until many months later, at the earliest, because those small changes of degradation, it takes time for those to accumulate to where you finally see the end product. So I can't say that it stopped working for you. I think it's just a very extremely slow progression that you're just now noticing. And over to what Spencer said, I agree 100%. I'm not a doctor, but in my experience, it is a dose-dependent medication. So consider after you speak with your physician about it, or your trichologist or whomever, consider upping the dosage by if you're doing a quarter tablet, maybe do a half tablet a few days a week, and then a quarter tablet the other days of the week, just to kind of build yourself up, and try that for a while, and don't make changes every few weeks, because you don't know what's going to work. That might be enough. So stay the course for 6 months, see how that works out. If there's no change, then you're good. Keep going that way.
Yeah. Oh, that's true, guys. I really appreciate it. And also, one more question I have to ask. I've got a consultation in the Maitland Clinic with Dr. Ball in April. Basically, I had some spare cash in the hip. Didn't do a lot of research. Went and had a hair transplant, and he has completely destroyed my hairline. No singles, literally just a whole bunch of trebles and quads in the hairline. It looks awful.
Was this
was
this done in the UK?
Yeah, it was done in the UK, obviously. But I don't know, the doctor's name's Camilo Diaz. Don't know if you've heard of him before.
I have.
Probably bad things, I'd imagine. But I'm going to go see Dr. Ball and hopefully get a repair case done by him, because I watched one of your videos, Joe, and he's meant to be really good, isn't he?
Yeah, I think he's I mean, well, he passed my review, but I think that beyond just passing, my standards, my review, I think that he's one of the most underrated doctors in the world. Like he's
Really?
yeah, I really do. Like he is he's really picky about his hairlines. He's also conservative with the placement on most of his patients, and I've seen him actually turn down patients that would easily be considered a candidate by any other clinic. He takes a cautious approach, which I like. I like that a lot.
Yeah.
But in a case like yours, you've had a bad hairline procedure, and so it's not so much of matter of turning you away because your expectations are unrealistic. This is the kind of case that I feel he's very creative, and he's quite good at.
Yeah. Oh, wonderful. That's brilliant.
Yeah, he's good. That's all I'm going to say.
Yeah.
Yeah.
Cheers, guys.
All right, man. Well, listen,
Yeah.
good luck. I'm sorry that you had a bad experience, especially at such a young age.
It happens, and it's my fault entirely. I didn't do enough research, so shit happens, and we try and get it prepared.
Well, listen, good luck with your consultation. When is your consultation?
It's the 28th of April.
Okay. Well, good luck. Okay. And yeah, I mean, you could also, talk since you're going to see Dr. Ball. Talk to Dr. Ball about your, finasteride use. And I think that, look, dutastaride's always going to be there. Yeah. I'm a firm believer, and again, I'm not a doctor. I have to keep saying that, but I'm a firm believer that finasteride is dose dependent. So,
is the finasteride hasn't been FDA approved for hair loss, isn't it?
Yeah, it has been. Finasteride.
Yeah,
Dutasteride, sorry.
No, dutasteride has not been. And here's the thing. Dutasteride was approved for benign prostate hyperplasia, I think it was in 2002. And the talk of the town was that it was, everyone was really excited about it for hair loss, and that was going to be the next step. And Glaxo just decided not to pursue it. And
yeah, they had it in trials, but they ceased it. They canceled the trials quite a way into the study, I think, or the trial. I think I don't remember how far, but yeah, they were looking at it and then canceled it.
Yeah, I mean the word on the street, and again, this is hearsay because Glaxo did not make this announcement, was that the side effect profile was too great, and the time it took for the side effects to subside because the half-life of the drug is so much greater was not something that they were willing to risk. They felt they would receive too many complaints. There'd be too many issues.
Okay.
However, there's a lot of people who take it with great success. It could always be a part of your arsenal if you need it in the future. But to me, it's kind of like a hair transplant. So it's a last resort.
Yeah.
Yeah.
All right, man?
Yeah, sounds good. And next time when you appear on your show, drink a bottle of Coronas.
Yeah.
That'll be hilarious.
I will. And the sad part is there are actually human beings on this planet who are afraid to drink Corona beer.
No,
yes.
You're shitting, mate.
I'm not shitting you. There's all over the news.
Nope.
Well, we best go out and buy loads then.
And these are the same guys that end up getting ripped off in this industry. So anyway, you take care.
Yeah, you take care, guys. All the best.
Okay, bye-bye.
All right, thanks for calling. Good call.
Good call. I hope I didn't insult him with the rip-off thing. You didn't get ripped off. You made a bad, you didn't do your research with surgery. It happens.
Well, here's the thing. I disagree with what he said. He said it was completely his fault. He didn't do enough research. No.
I disagree with that too.
No.
Yeah.
I mean, yes, you do need to do your research, and ultimately, you are responsible for your own decisions. But there's some doctors out there that they just need to close their doors because they're just so bad, and yeah, I mean they pull in these patients, they lure them in, and knowing. Oh, I can't say knowing because some of the biggest hacks out there, especially in the UK, think that they are so good they should write a book. And it's amazing.
I would say that at the risk of getting a lot of shit for this, before the insane cosmetic surgery tourism and what's been happening in Turkey and places like India, occurred, the most dangerous market, in my view, was the UK in this field. It is still probably the third most dangerous market in the world.
I had a glimmer of hope for it at one point because there's some doctors that were doing or are doing some good work, but the sheer volume of new clinics that are opening up that are doing absolute junk work makes it even worse than it was 15 years ago.
I would say there are
Well,
three that and two of whom are IHRS members. I would say there are three, maybe four, that I would consider to be doing state-of-the-art work. Yeah, that's it. That's really it. And some of the guys that you're thinking of are probably not the guys that I'm thinking of who are doing the good work.
yes.
Now, there is
most
an
likely.
association in Britain of hair restoration surgeons.
Yes.
I got to tell you, there's only maybe one or two guys in that association that are, maybe three actually, that can even compete with some of the real leaders in this field.
Well, keep in mind, it's not a quality standards-based organization. It's simply an educational resource.
I try to keep that in mind, but that's not the way they fucking promote themselves.
Of course.
You know? They promote themselves as some sort of an authority, and as opposed to a trade organization, in my view.
There's I think this is the caller at J-UK21 says that he made a complaint and a doctor tried to sue him or threatened to sue him. That's a very common response.
Yes.
Very common response. But even in the UK, I'm not an attorney. I'm not a barrister. Or, excuse me, a solicitor. A barrister is a judge. I'm not a solicitor. But even in the UK, as long as you're simply not embellishing your experience and just laying out the facts, then you're safe.
But the fact that solicitors and attorneys in Canada still have to wear those powdered wigs in court freaks me the fuck out. They don't?
They don't.
I thought they did.
No. In some cases, but not all. It depends on the kind of court, I think.
I thought that if they were in a courtroom.
No.
Really?
No. Really.
I'm watching too many movies.
I think so.
All right, guys, let's call it a night. Let me turn off the phones.
Please. Okay.
Please. Ow, my wrist.
Well, I'm sick. It's like I gotta go do my stuff. I'm not feeling well.
You have corona. Everyone's sick. I think everyone's got it.
No. I have Dos Equis. I don't have corona. I got Dos Equis.
Do you want to give out some websites or no? What do you want to do?
I got Wu-Tang Clan. Nope, not today.
Okay, hairtransplantmentor.com is Joe Tillman's personal website. Check out everything Joe Tillman at hairtransplantmentor.com. If you want to check out this broadcast live, if you want to see us in studio, my advice would be to subscribe to Joe Tillman's YouTube channel, which is youtube.com/ how's that, Joe? / Hair Transplant Mentor. That's youtube.com / Hair Transplant Mentor. The Bald Truth is thebaldtruth.com for archives for this broadcast. Oh, by the way, subscribe to his page. Click the likes on all the shows, on all the videos, on this one that you're watching right now, and ring the bell to make sure that you're notified when Joe or this broadcast goes live, or if Joe uploads a video, or whatever Joe decides to do on that channel.
We don't know.
And also, do me a favor. Go to youtube.com / baldtruthradio and subscribe to that channel. We are going to be putting up some really interesting segments, and we're starting a new series soon, which I think you guys are going to be very, very interested in. So please, we want to grow that channel as well. Okay? It is a offshoot of Joe's channel and, of course, The Bald Truth. You're going to see shorter segments of The Bald Truth podcast and recorded broadcast. And there are going to be undercover doc segments and a lot of interesting stuff. So do us a favor. That's the way you support us. Not monetizing the channel. Just show your love by subscribing at youtube.com/baldtruthradio. Subscribe. Click the bell so that you get notified when I upload or when we upload videos. And that's all I want you to do. Also, iTunes. Podcast is back. It's on iTunes. Check out Spencer Corbin's The Bald Truth on iTunes, and please subscribe. Okay? You could also give us a 5-star rating. That would be great. Make it happen, guys.
That'd be great.
That'd be great. Baldtruth.com. Again, thebaldtruth.com, not baldtruth. Thebaldtruth.com is our website. Archives of this broadcast. AmericanHairLossAssociation.org is the website for the American Hair Loss Association. If you're considering surgery, check out the International Alliance of Hair Restoration Surgeons at IAHRS.org. And the message forum is baldtruthtalk.com. Guys, just be safe out there. Don't freak out. This is going to pass. Until next time. Watch, I don't make it for the next show. Until next time, be strong, God bless, and thank you so much for listening. Have a good night.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.